Welcome to the Northwest Board of Education meeting. Please stand with me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Amy, can you take roll call, please?
Mr. Gilbert?
Here.
Mr. Detzel?
Here.
Mr. Teesort?
Here.
Mrs. Detzel? Here. Mr. Yoshimura?
Here. Okay, first agenda item is Master Facility Plan Update.
Are your microphones turned on because they don't seem
So good evening. Tonight we're going to do a master facility update. We've been talking about this for several years now, and so this is just an update to our previous conversations. We're labeling this Building an Equitable Future. And so we're looking for all kids at all levels that deserve a great learning environment and an engaging student experience. And currently we have buildings that have a 1.3 million in square feet at a value of $285 million for all of our buildings. We currently have $40.5 million in deferred maintenance, and this is after this past summer we put $6 million into our HVAC through our ESSER funding that we received from the federal government, and $500,000 from our PI fund, our Permanent Improvement Fund, for roofing. And typically, renovations or repairs are 4 times that of maintenance and maintaining, so when we have deferred maintenance, it's increasing our cost to fix. And our current funding, annually we get $800,000 into our Permanent Improvement Fund to help us with our ongoing maintenance. This doesn't help us when we have $40.5 million in deferred maintenance that we need to address right now. And this $40.5 million does not include Colerain-L or Colerain Middle because those were included in phase 2 of our building plan, our master facility plan, so those aren't included in the deferred maintenance costs. And these costs include things like roofing, which 10 million of the 40 is just in roofing alone. We have additional HVAC issues, as well as lighting, blacktop, concrete, and things like that. So then Daryl's going to talk about where we've been and where we're going.
So we'll go back to 2014, and we had a master facility plan in place. That 2014 plan is the plan that we used, and phase 1 of that plan was actually building the 3 new elementaries, one of which we're in tonight. And then the other buildings received some level of upgrade or renovation based on that phase 1 plan. Right now, we are in the process of updating that plan. As we update the plan, we have 3 things to keep in mind. The appropriateness of the education within the building, making sure that what we build is educationally appropriate, that it is financially responsible, and that it is community supported. So we need a plan that has all 3 of those things in it. We have 2 committees right now that are meeting. We have an educational visioning team and a community advisory team. Those 2 teams continue to meet right now simultaneously, and they both have slightly different purposes. So the educational visioning team is the team that is really looking at long-range vision for what does education look like. We've done the portrait of a graduate, and our community has said this is what we expect the competencies to be for all of our students throughout our entire system, but especially maturated when they graduate from the program. And we have the strategic plan that outlines what our educational vision is in terms of our student achievement. So this team is really looking at all of that and trying to vision out into the future, what do the classrooms need to look like in order to teach in that way. The other team that is meeting is the community advisory team. This team is really getting into the nuts and bolts. A lot of what Amy talked about in terms of deferred maintenance, the conditions of the buildings, which ones are worthy of renovation, which ones need replaced. And they're taking information from the educational visioning team and trying to merge that into what does that mean for our facilities, which ones need to be replaced, and if they need to be replaced, what are some of the components that need to be in that new building? So really merging the educationally appropriateness with that community support. So those two teams are continuing to meet. Right now, when you look at our buildings, this just shows the cost to renovate the current buildings that have not been replaced yet. Amy went over some of those numbers and they're astronomical. When we get to phase two is really taking the plan that the teams are going to create and then looking at what is our next phase. What are the next components that are most pressing in order to be addressed? We have on our website, on our homepage, on the top left, a red icon called Building Our Future. And this is a website where all of our information from those two teams is being housed. In fact, complete audio of the meetings that we've had are there so people can watch them and get caught up with what's going on. As we continue this process, we will have a community forum. We've already had one. It's open to everyone in the public, not just our parents now, but our community members throughout the entire district to hear what's going on and get an update. That will be coming up on September 23rd, and that will be virtual, so no matter where you're at, you can still tune in. We will also have a community survey as the plans start to take shape so that we can put that out to our community beyond just our current parents, but to our future parents and our alumni as well to make sure that they support what the team is coming up with in terms of the educational vision and the community support for those plans. So we'll continue to update the community as we move forward. The plans should be out by October, so we'll make sure that between then, during September, we'll continue to engage and get the survey out. Next, we wanted to just give everyone an update on our COVID response plan. And I do understand that this is a sensitive issue. And I have had many conversations with parents and community members about this topic. We've had extremely polite conversations and I think very fruitful conversations. Unfortunately, not all of those have been in that vein, and due to some of the communication that has been a little bit different than that in terms of its tone and content, unfortunately we do have Corning Township here tonight. We are always open to engage with people and hear and listen and talk, so I encourage people to continue that conversation. Want to just do a little bit of a history lesson and go back in time. Seems like a long time ago, but it was just this summer. And we had guidance that was coming out all summer long from various organizations. The American Academy of Pediatrics came out with their guidance for schools on July 18th, saying that they are promoting vaccinations and that masks should be worn regardless of vaccination status by all individuals inside of a building. On July 27th, the Ohio Department of Health came out and they again said that they were suggesting vaccines and that masks should be worn. The state of Ohio legislature weighed in this summer as well. Governor DeWine signed House Bill 244 that prohibited schools from mandating vaccines that are not fully approved, and they also prohibited schools from discriminating against those based on their vaccination status. So you can't make vaccinated or unvaccinated students do something different than their peers. That basically took the what happens in the community right now, where the guidance has been, if you're unvaccinated, please wear a mask. If you're vaccinated, we couldn't do something like that because of this. There are some other bills that have been introduced that would block public schools from requiring masks and doing a mask mandate. The legislature is back in session now, so some of those are in committees. Then on August 4th, the CDC came out and said that they were promoting vaccines, masks should be worn by indoors, and that we should do our social distancing, screening, hand washing, and having a layered approach to our prevention strategies. We did ask our parents what they thought. Input is very important. And we did have staff and parents who said that over 50, close to 60%, were in favor of a mask optional policy. So we were soliciting that feedback because we wanted to hear from our parents. We had a board meeting on the 9th where the board actually passed a mask optional policy, and we said that that meeting that we would continue to monitor data and guidance and make adjustments as needed. After that meeting, we had a lot of people asking us, what data are you measuring and what are you going to do? At that time, other districts were making decisions at board meetings, we're going to masks, we're not, and we didn't want our community to be surprised by any decisions, so we wanted to be completely transparent. So after that board meeting, we actually had guidance from ODE around quarantines that we should maximize social distancing, continuing to try to maximize as much as possible, knowing that as we came back this fall, we were bringing more kids back, and that was going to be more of a difficult situation. On August 17th, Governor DeWine came out and said that he recommends that all school children be vaccinated and that everyone should be wearing a mask, but he was not going to mandate that, and that we should make our own decisions based on data presented. Again, we went back to our local data. So when we went to our local data, that's what drove us to the tiered response plan that we approved as a board on August 19th. The tenets of that plan have been three things. We want to keep schools open all year and in person. We want to maintain normal instruction as much as possible. That means kids in science doing labs, working with teachers in small groups, and having a normal instructional experience as much as possible. And we want to minimize quarantines. Our teachers can't teach kids who are not in person and are not there, and we need them there as much as possible. When we started looking at our local data, we have tracked this data for over a year. This is Hamilton County data for the past year. That spike you see there is last fall. That's from about at the bottom of the spike under the arrow around late September, October, and then it spikes up to the top around January. When we looked at our data, we wanted to make sure that as we put interventions in place, that it was not a blip in the screen that was just like the little hill at the bottom of that. We wanted to make sure that when we put an intervention in place, it was actually trending in a direction that was not just an anomaly. So that where that arrow is where we benchmarked our plan to. We benchmarked it to the middle of last year's surge. When we did that, this is what the data came out as. We measured zip code data in our district. This does not encompass every zip code in our district. It encompasses the zip codes of our buildings. So we use our buildings as the anchors for the zip codes we tracked. That 9 was the 7-day average of new positive cases at that point last year where the arrow was on the previous graph. The county trend was 255 new cases per day on a 7-day average based on where that arrow was. And that is above and beyond what the CDC says should be your level of red. We tracked our student and staff positive cases. We had an average of 14 positive student cases per week during that surge and a number of 11 positive staff cases. So we used that as our benchmark. We also looked at quarantines. We were averaging about 65. We said 75 seemed reasonable, so we went to 75. And then our CDC level of community transmission, which they've had us in red for a while now. That was the data we said we would track. And then as each of those hit a benchmark, we would layer intervention strategies in place that would reduce quarantines. So isolation and quarantine are two different things. An isolation is for a person who is positive. If someone tests positive, they go on isolation. Quarantines are for people who are considered to be a close contact. Close contacts are defined as being within 6 feet of someone for 15 cumulative minutes, not consecutive, but cumulative. So those are the two definitions that the Ohio Department of Health has out there that we have to follow. If 0 to 1 of our indicators are triggered, we continue to do what we do. Over the summer, we upgraded ventilation. Amy mentioned the $6 million to upgrade ventilation, recirculate air, and put in ionization systems to clean the air. And we still have our cleaning protocols, screening stations, and we ask everyone to do a self-screen before they come, frequent hand washing, and we recommended masking, but we did not mandate it to start the year. When 2 indicators were hit, we limited visitors in the building, and we modified lunch. Modified lunch means that our buildings were looking for ways to do lunch in a way that reduced quarantines. That does not mean lunch in a classroom. Our buildings did a really nice job of seating charts that mirrored the classroom so that students who were sitting by each other in the classroom may also be sitting by each other during lunch. That way they're not exposed to multiple kids and the increase of quarantine risk is there. So our buildings have been very intentional about how they've tried to modify their lunches. When 3 indicators hit, we went to universal masking for everyone in our buildings. Unfortunately, that happened very fast. Our data has trended since we began in August in an astronomical fashion. When we hit 4, we went to capacity limits to try to, our kids we know are at all of our events, and we're trying to make sure that the number of times they can be exposed to someone who could create a quarantine for them is reduced. When we talk about that, we actually phased that in. We know that as that happened, it happened fast, and a lot of our buildings had events planned and have put a lot of work in those events, and we want to honor the work that they put in to these events. So we phased in what those capacity limits look like. So just to give you some context of what that looks like, I'll take Colerain High School as the example. Worked with Matt Stoynoff, and Matt did the work on this, so he deserves all the credit. But he looked at the stadium capacity and looked at how do I take all of the available space and how do I maximize that, not just the stands. So looking at all of the grassy areas and being able to use all of those for additional seating. So our current capacity is about 7,000. Our average attendance at a Friday night football game is around 2,500 to 3,000. By using all that extra space, at 75% capacity, the stadium would be able to hold 7,900 people. At 50%, 5,000 people, and at 30%, it's still a little over 3,000 that it would be able to hold, using all of our available space to socially distance, so we can still make sure that people have the ability to be at the event and participate and enjoy it, but in a little bit of a different format where it's socially distanced. And
so, to put that in perspective, do you know what the numbers were for our limited capacity last year?
So how do those numbers trend for our limited capacity last year? The 7,000 would probably just be taking 30% of that because we didn't expand the capacity of using the grassy areas. So when you take that, you're looking at a lot less. When we get to level 5, we're talking about limiting movement or exposures. Again, every step of this plan is about reducing quarantines and keeping kids in school. When we talk about limiting movement, we are not cohorting. We are not going back to cohorting. We are trying to stay open and look normal. And so the exposures are about trying to reduce that. So we're not cohorting, but there might be similar seating charts in different classes. Now I might be sitting next to the same person in language arts, math, and lunch to try to reduce the number of times I have the potential to be quarantined. And our buildings are working through those plans. At 6, we would look at intermittent active screening, where it would be intermittent temperature checks and screenings, much like we've done in the past. So that would be when we hit level 6. Our plan is meant to be flexible and respond to the data. So when we get to the data points, it imposes those levels of intervention. Once the data trends back down, the levels of intervention peel back. So as we fall below those benchmarks for 3 weeks, and we see that we're on that downward trend, we start to peel back those levels of interventions. Or obviously, if any orders come from governmental agencies, they would supersede the plan. The other thing is if there was a vaccine available for all age groups, we would be able to kind of talk about moving those and rolling back those because the availability of the vaccine for all students at all ages. So the board passed that plan. On August 26th, Hamilton County Department of Health came out with additional guidance and said, oh no, by the way, when we talk about quarantining, the masks don't automatically save you from the 6-foot social distance. They only save you from the 3 to 6 foot of social distance. Within 3 feet, with or without a mask, you're still quarantined. So when this guidance came out, it kind of changed the game a little bit because we want to keep kids in school. That's the end game for us. And masks were a way to reduce quarantines and keep kids in school. So for this, the guidance basically came out and said, with or without a mask, within 3 feet for 15 minutes, you are quarantined unless you are fully vaccinated. Our guidance that we've gotten from Hamilton County, when a person is vaccinated, if they test positive, they have to quarantine. Anyone who tests positive, regardless of vaccination status, must isolate. If they are identified as a close contact and they are vaccinated, whether they were within 3 feet or between 3 and 6 feet, they do not have to quarantine. If someone is unvaccinated, if they test positive, they must isolate just like everyone else. If they are unvaccinated and they are a close contact, and the close contact is within 3 feet, with or without a mask, they must quarantine. If they are from 3 to 6 feet, and they are without a mask, they must quarantine. If they are within 3 to 6 feet and they're wearing a mask, they do not have to quarantine. So the masks keep us in that 3 to 6 foot range from creating quarantines for our students. One of the things that we did, because of that changing guidance, I walked the building, several buildings with several people, and we looked at classrooms. And we literally went to a random desk and said, if this child sitting here tested positive, how many close contacts would there be? In most classrooms, it averaged between 2 and 4 students that would be taken out as a close contact with the student who has to isolate. So we did call a PD day on Friday, September 10th. That day was meant to help our staff go through, know all of the rules, and be able to have our administrators work with them to minimize quarantines. And I know there were things on social media that we were going remote. That was time to give in our teachers' plan to go remote. No, our plan has never been and is not to go remote. Our plan is to stay open. So when we look at this, when we went to classrooms, teachers want to work in groups with kids. It's a great instructional strategy, and we encourage that. The first picture on the left shows the way the desks were. That would result in 2 close contacts. So out of that grouping, a positive case would lose the positive to isolation and 2 students to quarantine. By making a simple adjustment and pulling the desks apart, no quarantines result from that new configuration. Our staff actually have worked to put markers on the floor so that students have visuals where the desks are supposed to be so that they can make sure that they are protecting kids from quarantine. Students sitting at a table like this, when they sit side by side, they are a close contact and are quarantined. The simple shift of now having students straddle the legs on each side of the table, they no longer are a close contact and they stay in school. We don't make up the rules, we just have to follow them. So we are doing everything we can, everything to keep kids in school. Based on the rules we have to follow, we are doing everything we can to keep kids in school. Just by adjusting some chairs, even in a traditional arrangement, 0 quarantines. Some of our elementary classrooms, they want to use their kidney tables for small groups. So this one on the left shows the markers which create that 3 feet, So students have defined spaces so the teachers can still work with them and maintain quality instruction while minimizing quarantines. And then you can see on the right, they've quarantined off the table. They have students in a diamond shape, and by staying in those areas, the students are still able to collaborate but avoid a quarantine. This is where we are as of now for our data. As of today, we update our data every Monday between 3 and 4. The data that we input is from Tuesday through Monday at 3 o'clock. So our data stays consistent. We did just have Labor Day, and so the data was updated on Tuesday because of the holiday, but it only included data through Monday at 3. So we stay consistent with our reporting period, so our data stays consistent. As of now, you can see that of the 5 zip codes that we are tracking, 4 are now over the indicator. The county trend, our benchmark was 255. It's currently at 345. Last week, we had 67 positive students district-wide, 6 positive staff, 222 student quarantines, and obviously we're still in red for the CDC level transmission. We are hoping that after we've done the work we've done with our staff on Friday, the quarantine numbers will come down because of the work we've done to make sure that our classroom environments keep kids in school. The goals have always been these 3 things: stay open, stay in person, minimize quarantines, and have teachers doing the kind of instruction that they know is important and that works. That's what we've been trying to do. I do want to pull up on our website. We do have 2 places where our data is tracked. So this is our Cova Tracker. It was live all of last year. It is still live. You'll see on here, and I know there's been some confusion, it says August through December because that's how many bubbles are there. That's the months that are represented on this. You can see that up through all of August, it was 56 positive students. September is 67. Just so people are clear with how the data is tracked, it is tracked based on the month in which the week starts. So there was a week that spanned the end of August and into September, and people were confused about where the data was. It was in August because that's the week in which the data started being collected. So we always use that as the benchmark of where the data goes. This is week by week, so you'll see here that this is September 7th through the 13th. We post this every week. It's every school, and the schools list the staff positive, the student positives, the staff quarantines, and the student positives. So you can see our data disaggregated by building and by week. So you can scroll through here and see that was the week of September 17th till the 13th. Before that was the 31st to the 6th. So you can track that data with us, but it all lands on this home page in cumulative numbers of positive cases. We don't track the numbers of quarantines, but the positive cases. We also have on there this plan. This is our dashboard for the tiered response. So it always gives you on the front page the number of indicators that we've hit. Right now we're at 5. But if you scroll through, this tells you as of the most recent week, which this was just updated a couple of hours ago. This matches what was in the PowerPoint I just shared with you, but you can see the zip code, the county, the student and staff positives, the student quarantines, and the CDC. So we've tried to be transparent as we've gone along. We've tried to put the data out there in a way that is locally determined, so using our local data, and putting interventions in place. The entire purpose of our plan has been to keep kids in school and keep instruction in person looking as normal as possible. All right. Anything? Okay. All right. Thank you for that.
Joe, I have a question.
Yep.
I know that the zip codes are where the buildings are. How many other zip codes are not represented?
He's asking how many other zip codes are not represented based on the 5 that we track based on the buildings. I believe there's about 2 or 3 more. I'd have to look.
Are we allowed to ask questions?
They are. Sorry. Any other questions from the board?
All right, thank you, Daryl.
I just have a comment. Can you hear me okay? Yes. Okay. All right, so my comments are, I took time off on my Friday to visit Coleraine High School and Struble Elementary to see firsthand what they were doing in the classrooms when it comes to spacing. So as you saw in the pictures don't really do it justice. It's just amazing to me, that they were going around to every school, every desk with literally a, yardstick, a 3-foot stick, and making sure that the students were spaced apart 3 feet anywhere that was possible. And it was in some cases as simple as spacing out desks by 6 inches, going from that 30 to 36. And then we're, so I just, let you know that there was a lot that was getting done. Some of the classrooms that we have a classroom at Coleraine High School that, 50 students. And it wasn't necessarily clear in the graphics, but they went through and a lot of the desks were marked in tape on the floor so that if the desks get moved, the students and the staff know where this desk belong, so to maintain that 3 feet with the desks, the chairs, and markings on the tables. So I was really impressed that they got a lot to do.
And Matt, you bring up a point that we were not able to do that in every space in our buildings. There are spaces where students are within 3 feet just simply because of space constraints. All right. Any other questions?
I'd like to make a comment. I don't know if you can hear me or not. First of all, anybody, if they've been watching the news, I want to say that I don't think anybody can disagree that this district has done a phenomenal job on the number of quarantines. We could be like some of the other districts that are having 1,000 kids out, and they're smaller districts than us. We have districts in Hamilton County, Butler County, Warren County that have closed down because they have so many quarantines. So whether you take this serious or you don't, I want to commend Daryl and his staff for taking the time on Friday, as trivial as some people might think, but the fact that they took the time and went to every classroom and marked all this out to keep our kids in school. Because what we heard over and over and over again last spring was everybody wanted their kids back in school. Their kids were struggling, and so on and so forth. So again, I just want to thank you for that. We
have tried to follow the rules that have set by us by the Department of Health, and so as we follow those rules, these were the parameters that we felt would keep the most kids in school. Thanks.
Exactly, because there are certain rules that we do have to follow, and just an FYI, everyone up here is vaccinated. Thank you.
Okay, that brings us to legislative updates.
Okay. All right, so the Ohio House of Representatives and the Ohio Senate will resume committee hearings and floor sessions in September, which we're in now, as they continue to work on legislation. It is expected that the legislature will have a busy fall agenda on topics regarding redistricting, sports gambling, mask mandates, and vaccinations, among other issues. So there are bills pending in both the House and Senate that would prohibit mask mandates. Senate Bill 209 would prohibit, after the 2021 school year, the State Board of Education, Ohio Department of Education, and school boards from mandating masks to any person who is on a school's premises, including those attending in-person instruction, school-sponsored athletics, and school-sponsored extracurricular activities. Senate Bill 209 also includes higher education and businesses. House Bill 400 would prohibit a school board or an individual school from mandating a facial covering for a student on the school's premises or on a school bus. The two bills differ in that House Bill 400 only applies to students and does not include higher education or businesses. And then, let's see. Senate Bill, so this one I found interesting. Senate Bill 176 would legalize, regulate, and tax sports gaming and pass the Senate in June. So what does that have to do with schools? Goes on to, the bill would prohibit betting on any sport or athletic event for primary or secondary school students. It also would require that 98% of the profits be used for K through 12 education. And then recently introduced legislation, there was Senate Bill 214 was introduced by Senator Tim Marath, hopefully I pronounced that properly, to require the state superintendent of public instruction to develop model curriculum on Asian American history and to require school districts to include instruction in Asian American history to K through 12 students starting in the 22-23 school year. And that's all I have. Thank you.
Thanks. Pam, do we have any student achievement?
Yes. Even with everything going on, there's a lot of wonderful things going on in the classrooms each and every day. For those of you that had the opportunity to be at our last meeting and see the kids that participated in the summer programs to get them ready and to catch them up from everything that happened last year, the kids did a remarkable job. But tonight we'd like to congratulate Colerain High School students Elijah Smith, Grace Gearing, Olivia Habio, and Ed Lockwood on being accepted to sing with the All-Ohio All-State Choir. They were chosen by audition as one of the top 100 singers in the state of Ohio and will sing at a concert in Cleveland this February for the Ohio Music Education Association Annual Conference. This is the first time in decades that students from Colerain High School have been selected, so what an honor. So a big round of applause and a big congratulations. To all those students, and we wish them the best of luck, and it's great news. Thank you.
Thank you for sharing that, Pam. Butler Tech?
Nothing tonight, Mark.
All righty. Hi. Daryl, are there any reports from any employee organizations?
None at this time.
All right. So that brings us to your guys' time. I apologize for the meeting starting a little bit later because we had a lot of submissions. So we will be taking a vote to extend the time that you guys will be allowed to speak because we want you to be able to speak. So at this time, I would need a motion, excuse me, and a second to allow each speaker to have 3 minutes with no end total time.
So we have 8 submissions, right? Is that what you
8
said earlier?
submissions, yeah.
So I'll make a motion that we allow 3 minutes for the 8 people. So if my math correctly, that's 24 minutes total instead of the usual 14 that our policy would permit. So a motion to allow 3 minutes for the 8 people.
Second.
We do it a verbal vote.
It's fine.
So just to be clear, normally our policy, which Mark hasn't read yet, is 3 minutes with a maximum of 15 minutes. So normally what we would be doing is reducing everybody's individual time. So that's why we're making the motion for 3 minutes for everybody.
Mr. Gilbert,
Yeah, I approve.
Mr. Detzel,
Aye.
Mrs. Detzel,
Aye.
Mr. Teeswort,
Aye.
Mr. Yoshimura.
Yes. Okay. All right. So let me take a big deep breath for this policy here. The Northwest Board of Education welcomes the opportunity to listen to Northwest Local School District residents' comments, suggestions, and concerns on educational issues. It is important to remember that the board conducts meetings in public, but the meetings are not public forums. The intent of the meeting is to allow the board to complete needed business. Northwest Board of Education meetings are conducted using Robert's Rules of Order, newly revised. Most matters which fall under the jurisdiction of the board may be addressed during the community comments section in the order of business. The board will not discuss negotiations or personnel in an open session. Any concerns or comments about individuals ought to be brought to the attention of administration. The school district cannot discuss personal student information, whether or not discipline was imposed on a student, nor the reason for the decision, because disclosure would be a violation of state and federal law. The following guidelines will be used for public commentary at board meetings. Individuals wishing to address the board must complete and submit a request to speak form. to the board president prior to the beginning of the meeting. Individuals will preface their comments by an announcement of their name, address, and group, the affiliation if applicable. Each person will be given 3 minutes to speak on the agenda during the community comments. Public commentary is confined to that portion of the agenda. Individuals will be recognized to speak once on a given topic. All statements shall be directed to the presiding officer. No person may individually address or question board members, district administration, or members of the public attendance. No response to the speaker will occur from board members, district administration, or members of the public attendance during this time. Appropriate follow-up by district administration will occur at a later time if warranted. No, we won't read that one because we are approved more than 15 minutes. Repetitive statements may be ruled out of order by presiding officer, and the presiding officer will have the right to terminate the participation of any individual if the person violates the rules of good order. Laws of the state of Ohio determine the powers and duties of the Board of Education, the superintendent, and the CFO treasurer. So like we mentioned, there was 8 submissions, and the first comment is by Stacy Danielson. Please come to the podium.
Hello, thank you for allowing me to speak. My name is Stacy Danielson. I'm the mother of 2 Colerain High School students. We've been in the school district for 3 years, and I'm here to ask you to unmask our kids. You voted for masks to be optional in your meeting on August 9th, based on the surveys that were completed earlier that month. Those surveys showed that 60% of the parents and staff that responded wanted masks to be optional. The superintendent and his team were asked by concerned parents that wanted masks in place from the start of school to provide information about when masks would be implemented universally. In a meeting that we had today, he expressed that the tiered system was designed by them based on an average number in the school district from last fall and winter. When I first looked at the tiered response plan, I knew that it would not be long before we hit the 3rd tier initiating universal masking. I really thought it would take a few weeks at least. But 1 week into school, we received notice that all the schools in the district would be going to this tiered system, even though many of them at the time had no positive cases and no children in quarantine. This is not an easy issue, as it stirs many emotions and thoughts in all of us, but we cannot allow our freedom as parents to make choices be taken from us. I'm asking on behalf of all the parents in the school district that you give us back our rights to be in charge of our children's health. I do not consent for my children to be masked for 7 hours a day for the little to no benefit it truly gives to mitigation of COVID-19. Data from a CDC study done in May shows that without a comparison group that didn't require student masking, it made it difficult or impossible to isolate the effect of masks. The journalist in an article called "The Science of Masking Kids at School Remains Uncertain," reported that he reviewed 17 different studies cited by the CDC in its K-12 guidance as evidence that masks on students are effective, and not one study looked at student mask use in isolation from other mitigation measures or against a control group. Some even demonstrated that no student masking correlated with low transmission. Eliza Perkins, the director of emergency medicine infectious disease management at Boston Medical Center, said a year ago, masks were not the end of the world. Why not just wear a mask? But the world has changed. There are real downsides to masking children for this long, she said, with no known end date and without any clear upside. She continued to say that she was not aware of any studies that show conclusively that kids wearing masks in schools has any effect on their own morbidity or mortality or on the hospitalization or death rate in the community around them. Please unmask our kids. Give parents back our rights as guardians of these kids. Thank you very much for your time.
Thank you, Stacy. Next, we have Rajagopal.
Thank you very much, Board, for letting me speak a second. My name is Raja Kapal. I'm a trustee for the Colerain Township. I just come here to announce we applied for the sidewalk funding from Colerain to the Taylor School sidewalk, and it looks very good. And in October, we'll know the result of the funding. We'll be building a sidewalk soon. It's been long needed, the program. Also, you also know about these sidewalks that I'm working with the Ohio Department of Transportation. They approved the money to build the sidewalk from the Northwest High School to all the Strobel Road. So these are the great news for the school district. Thank you very much.
Thank you, Raj.
Thanks, Raj.
Next is Thomas Morgan.
Mongan.
I'm sorry?
Mongan.
Sorry.
That's fine. All right, my name is Thomas Mongan. I just had some points I wrote down, express my opinion with the masking issue. But watching your presentation as well, I just thought it was interesting. It just seems, it's ridiculous that with the 3 feet, and it seems like the governor put down you guys have the option to have masks or whatever you're gonna do to mitigate the spread of COVID-19, and you made your own rules. And to abide by those rules, it just seems ridiculous, the 3 feet, making kids wear masks, but just off the top of my head. But I have a 5-year-old son who's in kindergarten at Montfort Heights. I was really disappointed with the decision to have him wear a mask. I believe it's robbing my son of being able to breathe properly and interact with other kids. I would understand, it would be understandable if there was a payoff for this, but there's not. The idea that you guys are going to control the virus is laughable. I mean, we were all laughing. You were even laughing that you put the kids on the end of the desk and it's going to stop a virus. It's ridiculous. Masking mandates has never correlated with the reduction of spread of COVID-19. I've never seen where a masking policy has been implemented and the reduction, we saw the graph where it went down. You point to all the data and all this stuff where there's more cases of COVID-19. Yeah, it's a virus. That's why it's going up. I don't see any point where you said we implemented masks and now it's going down. I'd like to see that if you do have it. And about the studies, I guess people are pointing all this data and all this stuff. All the studies I've read, like I said, hasn't reduced the spread of COVID-19. Though I have read studies where masks can stop COVID-19 from coming out of your mouth and infecting others. It's not the mask my son wears. He doesn't wear an N95 mask. He's not a surgeon. It's not properly fitted. It's a cloth mask. He sneezes. He's touching it. I'm watching you guys. You guys are touching your mask. You even dropped your mask, picked it up, put it back on. I mean, and you're an adult. I mean, he's 5 years old, so. The staff I see at the school, I love the staff. They're awesome. We love our teachers. They're not wearing their masks right. Some of them are down below your nose. I mean, and you're expecting my 5-year-old kid to wear a mask and it's going to do something. So I just came here tonight to ask you, please stop the ridiculous COVID theater. It's embarrassing and ridiculous. Let our parents decide what's best for their kids. I love my boy very much, and I want to be able to decide what's best for him. Thank you.
Next is Jen Barrett.
Good evening. My name is Jen Barrett. I have 3 children in the school district. I have shared a document when I submitted my speech paper, if you would like to refer to it, and I have more copies if you need them. Tonight I'd like to share Article 1 in the Bill of Rights in the Constitution of the State of Ohio, specifically Article 1, Section 21. It is the preservation of freedom to choose health care. In Part A, no federal, state, or local law or rule shall compel directly or indirectly any person to participate in a healthcare system. Note 1, compel includes the levying of penalties. Note 2, healthcare system means any public or private entity or program whose function or purpose includes the management of, processing of, enrollment of individuals for healthcare services, healthcare data, or healthcare information. Note 3, penalty means any civil or criminal penalty established by law or rule by a government established, created, or controlled agency that is used to punish or discourage the exercise of rights protected under this section. Members of the board, you have created a healthcare system here in Northwest Local School District with mandates for children to wear the medical device of a mask and participate in contact tracing. You require testing to reduce exclusion from school. You are compelling children to participate in the system by levying penalties. Children who do not comply with your mandates are excluded from in-person learning. You are a government-established, created, and controlled agency punishing and discouraging the exercise of rights protected under Article 1, Section 21 of the Constitution of the State of Ohio. To every parent in Northwest Local School District, you have the right to choose. If you would choose for your child something other than a mask mandate, the contact tracing, the quarantining of healthy children, and the testing to get back into school, this is your protection. You can make that choice for your child today because of the Bill of Rights of the Constitution of the State of Ohio. It says you can. You and your children do not have to comply. I'd like to share the oath of office for the school board members in the state of Ohio. Do you solemnly swear that you will support the Constitution of the United States and the Constitution of the State of Ohio, and that you will faithfully and impartially discharge your duties to the best of your abilities in accordance with the laws now in effect? Members of the board, you have failed to uphold your oath to support the Constitution of the State of Ohio. You have not acted impartially towards the law as you promised. I'm asking you now to uphold the Constitution of Ohio and stop implementing a healthcare system in Northwest Local School District immediately. In Ohio, $4 billion has been made available through the American Rescue Plan as an incentive for school districts to follow federal COVID-19 restrictions. I would like to ask you now, is Northwest Local School District implementing federal guidelines for the incentive of ARP funds? Are you purposely ignoring the rights provided by the Constitution of Ohio for money?
Thank you. Next is Monica Bowles.
You will not be responding to my question?
Can you guys hear me okay? Okay, hi. My name is Monica Bowles. I just want to say a few things. One, I know there's a lot of consternation around the mask wearing. I want to say that my father, my late father, who passed away, was actually a pediatrician. And so I believe in medicine, and I understand all the consternation around it. I do have a child in our schools who is too young to be vaccinated, and so we are taking every precaution so she doesn't get the vaccine. And I know several people who have unfortunately passed away from it. It's not a fun thing to go through. Having said all that, I want to redirect and remind everybody that we are here, and we're here so our kids can get a good education. And I'm going to speak from some personal experience. My daughter, who is in a school here, was an honor roll student, and the quarantining of last year, where we did the remote learning, had a tremendous negative impact on her education. We're still regrouping from that. It is not easy, and I just want to remind everybody that this stuff affects all of us in various capacities. We are in a family that is very concerned about education, and that is first and foremost in our household. I just want to say and remind everybody that we've had some schools that are still receiving Title I funding and continue to do that. And I think that while I understand there's a lot of consternation around mask wearing and things of that nature, at the end of the day, our kids are here to be educated. They are here to get a good education in our schools to prepare them for whatever path they choose to go moving forward outside of high school. I know personally I've had friends and some family members in our district who have left our district. They've moved, some have moved out into other public school districts, and then some have chosen to send their children to private and parochial schools. And each time that happens, that takes away funding from our kids here. I hope that we can get beyond this mask issue. I hope that moving forward, that we all, regardless of where you sit on the fence in terms of mask wearing, political persuasion and whatnot, remember that at the end of the day, we're here so our children can get a good, solid education. Can you hear me? Can you still hear me? And I guess I'm close to out of time, so I don't want to take too much time. But, you know, I just want to throw that out there, and, you know, I'm working diligently with my own child to catch up from some things from last year. So I just hope that we can all unite and get around making sure that our kids get a great education, because that's what we're all here for, and that message seems to have been forgotten. Thanks for listening. You guys have a good evening. Thanks for all you do.
Thanks, Monica. Okay, next is DeShonda Brown.
Good evening. Good evening. I'm here. First off, I'm not a person to come out and speak in public. It's really out of the norm. I'm really uncomfortable. But COVID is very personal for me. February 16th, my mom, Sabrina Brown, who was not able to get vaccinated, lost her life to COVID. It's personal for me. It's personal. So I commend you all for making tough decisions when it's not the most popular decision in our district. As a resident, as a parent, I'm fearful for my son who has asthma to be in school at times. And I'm wrestling with, should I keep my son in school? Should I do virtual? Should I move him to a district that requires masks? I love my community. I love my district. My daughter was a 2020 grad of Northwest, graduated 7th in her class. And I know she's excelling right now at Xavier because of what we do and the decisions we make in our district. Please, ma'am, and please, sirs, let's protect our children. Protect our children at whatever cost we have to, even if it's not the popular decision. I don't want to go through losing a family member or another family member or a friend to this horrible disease. When you have to take your loved one off the ventilator and say goodbye is the hardest thing in the world. And I don't wish it on anybody, let alone a kid. So please, let's not listen to popular opinion. Let's listen to our pediatricians who are urging our children to stay masked in school. Let's listen to our babies, because most of them are not making decisions off of their opinions. They're doing it off their parents. So please, let our children be our voices as well. They are our future. Thank you.
Thank you. Shonda, I'm very sorry for your loss, dear. Brandon Woman? Did I pronounce your last name correctly?
I brought some hand sanitizer so I can clean off this microphone that everybody's been talking into. First of all, thank you for this time. I'm going to keep it short because Brandon has a couple words he wants to say. I was really disappointed when I came in here and you started with the Pledge of Allegiance to the flag. Do you people understand what that means? It is allegiance to the flag of the United States of America. We are the republic for which it stands. We're one nation under God, indivisible, not in this case, with liberty. Liberty is freedom, in case you didn't know, and justice, that's fairness for all. This is a democracy. Majority rules, not minority. You talked about in your second slide, experience and environment. What kind of experience do our kids really get when they're wearing a mask all day? They don't even know what their friends look like. All they can see is their eyes. Second of all, environment. That's not a good environment for children. When you quarantine, do you realize that if a child in junior school gets COVID, they have to quarantine, but their younger siblings don't? You need to check up on some of the things you're doing here. Okay, I have 2 grandchildren in this school district, and one of them, who has been potty trained for absolutely ever, urinated and came home with wet pants on more than one occasion because he was too embarrassed to announce to the class that he had to go to the bathroom, to get someone from the office to come down to get him and escort him to the bathroom. He would rather hold it and wet his pants than go through that embarrassment. My other grandson, sick, vomiting, the mask. Do you understand that when we exhale moist air? Moist air goes into that mask, and then you rebreathe all that bacteria in. Masks are not helping. They are hurting. Yeah. Oh, shoot. All right. Well, I'll be quick, though. Okay. I implore you to give these people back their liberty and their freedom. FEAR, acronym, false evidence appearing real. That's what you people are doing. And lastly, I want you to show me, you showed all these other things, show me the proof, the science that masks work, that 3 feet, that 6 feet works. Show us that instead of showing us all that other stuff.
So I'll make this real quick. I'll take like 30 seconds probably. I've got some people in here that I don't want to offend. I've seen some coaches and some also people that also watch my children every day. So my big thing is I feel like this is more of a board of education, not really a health department situation that you really need to be involved with here. And also that if some people would do some research on masks, especially N95, they're supposed to block out 3 microns of diseases and bad things, but the coronavirus is 0.125. So, I just left Colerain Middle School or elementary school, and the principal and the vice principal, I'm assuming, loved my wife and mine's cologne. Now, how do you smell cologne through a mask? But a virus it's much smaller, very much smaller. It's just unbelievable, and I don't think that it's right. I have a son that has asthma, and I don't think that it's right to cover his face, especially with a lot of the information I see from children getting infections from pathogens such as tuberculosis and other things. So I won't take too much more time because we're only allowed to have 3 minutes. But if you want to, the one last thing I want to end with is I want to thank you for your time. But if you want to influence our children to stay 3 feet away, why don't you do it yourself?
Stephen, Ron?
This lady over here kind of covered what I was going to go over already, so he's saying the exact same thing.
Okay. Okay, that brings brings us to adoption of superintendent consent items.
So tonight we have 4 resignations, 5 initial appointments, 1 change in status, 1 retirement. We do have our insurance renewal for general liability that is on here tonight. And we have a vendor contract for nursing services, donations to Pleasant Run Middle School from Blackbaud, to Corey Middle School from Rick Ellis, to Northwest High School from K-12 licensing, Kroger, and Southwestern fundraising. So with that, the superintendent recommends the Board of Education approve the consent items as listed.
So moved.
Second.
Motion and a second. Any questions, comments?
I would just like to, we have a resignation of Chris Langford, a longtime employee. I believe we came in around the same time. I just want to wish her a very happy retirement and thank her for all her years of service.
Thank you, Pam. That passes 5-0. Next is approval of fiscal consent items.
Yes, so first we have to dispense with reading of and approve the August 30th regular meeting minutes, as well as we have 2 then and now certifications over $3,000. One is a prior year invoice, and one is an annual contract invoice that we got missed this year. And finally, we have 4 grants that we need to accept, approve, and appropriate. 2 are ARP funding for the federal government pandemic relief. One is for IDEA, which is for our special needs students, and the other is for early childhood for our preschool. And then we also have the AED grant that was provided to Cova Middle School. And we have a donation for Doris Ellis in remembrance of her for Cova Middle School to use for their neediest students. So with that, I'd like to ask the board to approve the fiscal consent items as listed.
So moved.
Second.
Motion and a second. Are there any questions?
I'd just like to, once again, for people to understand on the grants, it takes a lot of hard work by individuals to fill out, to actively go after and seek these grants. So congratulate them with the ARP funding, the IDEA, the early childhood, and the ED grant for Cova Middle School. Great job.
Passes 5-0. Thank you, Amy. Okay. Gerald, superintendent update?
Just quickly, I just want to thank the staff for all the work they did on Friday. It was a big ask of them to make some changes. Rooms are personal for teachers. It's very unique to each person's personality and how they teach. And to ask them to make some of those adjustments, I appreciate their flexibility and willingness to do whatever it takes to keep kids in school. And just one of the things that wasn't in the presentation that I'm seeing a couple of our bus drivers sitting here, buses are under a different law, so they are required to have masks, and they have been from the beginning of the year. So just an FYI and a thank you to our bus drivers. Friday, they had some time to do some professional development as well, and to get caught up on their seating charts and to do what they needed to do. And so I appreciate everyone's hard work on that day.
Anybody have any questions for Daryl? All right. Brings us to board member comments. Joe?
I just want to thank all the people that spoke today. I'm sure you're very fervent in your commitment to which side you're going to be on. I just want to make this perfectly clear. I have talked to pro and con as far as the masking is concerned. And it got kind of heated, both sides. Please understand, we're trying to do the best we can. We ask for community input that we got today, and I do appreciate from both sides. I think all the people in the district are challenged by many diverse problems. This is the major one, I think. And that we should face our challenges together for the well-being of all of our students. I implore that all partisan groups to dialogue with each other, set up meetings with the superintendent, break down the barriers, and find some common ground. Ideally, we can work together, knowing that we have the best interest of our students. I firmly believe this, that the superintendent and the director of curriculum are doing their very best to keep our schools open and our students safe. Thank you.
I want to second what Joe said. I appreciate everybody coming and giving their opinion. I hear you. I listen to you. You know, like Joe said, we've never been through a pandemic. I know we've been dealing with it for a year and a half, but we do hear you. And, you know, there is two sides to everything, so my thoughts are, I want to try and keep the kids in school because parents don't want the kids at home being taught. They want to try and get them into school. And if this is what we have to do, then this is what we have to do. I think this is the best for the kids to be in school, to try and
We the parents make the health choices, not the school board. You make school choices, not.
Ma'am, that's enough. That's enough.
So anyway, like Joe said, we're trying to do the best we can. And I'm sure it's not going to be, okay, that's fine. So anyway, and then Daryl, I just wanted to thank you for the master facility plan to get the community involved and see where we go in the next 30 or 40 years on our buildings. That's it.
Thanks. Pam?
We lost a longtime staff member last week, Allie Kirsting, and I just want to send our sympathies to not only her family, she has 2 daughters, young daughters, but to the staff at Colerain Elementary that she worked with almost 20 years and then was a staff member here, I believe, for the last 2. And so my heart goes out to that entire family for that loss. Another thing I said before, as far as the goal is to keep the kids in school. It is what is the most important thing for them, not only for education, but it is good for the kids to be around other kids.
Stop quarantining the healthy then.
And we are doing the best that we can to keep them in school and not have the mass quarantines that we are seeing in other school districts. I know we have both Northwest and Colerain Homecoming coming up this weekend, and I want to commend the staff there too that is working, that is trying to figure out how they can let this go on so that the kids do get to experience that and that doesn't get taken away from them, but to do it in a safe manner. And like Joe said, there's not a magical answer that's going to make everybody happy, but our job is to do what's best for the kids. And our belief is, after listening to and experiencing what nobody had ever experienced before last spring, is the kids need to be in school. So we're going to do everything we can to keep our kids in school. So thank you.
Thank you, Pam. Matt?
So I think it's important to note that the quarantine guidelines are coming from the county and the state health departments. So when we, as a district, are quarantining your kids, we're quarantining them based on those guidelines coming from the county and the state.
Ma'am.
And so when the county guidelines state that that more than 3 feet makes a difference. So we're also adults and have the option to be vaccinated up here. It's not time for back and forth. Okay. So. Whoa.
You don't make the health choice for my kids. That's why my kids are coming out of school.
I'd also
take the money that we give to the schools and we'll take them elsewhere. You guys don't even have any kids in our schools.
I have a daughter at Colerain High School, ma'am.
You care about your children. And this guy was at a soccer game saying he didn't even know that 60% of the parents had voted, so he's voting blindly. And that goes to show what our school board's made of.
Motion to adjourn the meeting?
Second.
Thank you. Meeting is adjourned.